Dr. Shroff, welcome to the Valder Beebe Show live out of Dallas, Texas. How are you?
I'm doing great. Thank you. How are you?
Thank you so much for joining us. I want to ask my audience a question before we begin, Dr. Shroff. I want them to ask them, did they know that October is Liver Cancer Awareness Month? Because according to the statistics I'm looking at, liver cancer is the sixth most commonly diagnosed cancer worldwide. Dr. Shroff, thank you so much for being here to talk about this important topic.
Thanks so much. I'm excited to chat with you.
Okay, tell us about liver cancer.
Absolutely. So as you mentioned, liver cancer is the sixth most common cause of cancer and a leading cause of cancer death worldwide. The most common form of it is called hepatocellular carcinoma. And we know it's actually one of the fastest rising cancers in terms of incidence. And unfortunately, because it doesn't produce a lot of specific symptoms, at the time of diagnosis, about 70% of patients present with what we call advanced or unresectable liver cancer, meaning that they can't undergo a curative surgical operation.
Who's impacted by liver cancer then?
Well, we know that we expect about 41,000 people to be diagnosed this year with liver cancer. And that's why I'm so happy to partner with AstraZeneca and raise awareness on this, because the underlying risk factor for developing liver cancer is cirrhosis of the liver, or kind of chronic inflammation. And that can come from a lot of different things. It can come from metabolic syndrome leading to fatty liver disease. It can come from hepatitis infections, from excessive alcohol use. But anything that causes that chronic inflammation and cirrhosis can then subsequently progress to liver cancer.
You know, doctor, going off script, I need to ask you, I'm hearing a lot about inflammation. Is this something doctors have decided that we need to know about and it's been around for a long time, or is it a new condition that we're dealing with?
Well, I think inflammation comes in a lot of forms, but chronic inflammation, chronic irritation of the liver cells, like I said, in the form of cirrhosis or other things, absolutely can be risk factors for developing certain types of cancers, including liver cancer. And so it is important to know if there's a specific organ that's chronically inflamed or chronically affected by that, because then you can monitor for development of things like liver cancer. Because the earlier we find it, we do have treatment options for these patients now.
So that leads into my question. So how are patients with these diagnoses treated then?
Well, I think in the 15 years that I've been doing this, it's been a tremendous amount of progress in the last few years. And immunotherapy is really a viable treatment option for these patients. And what that is the ability to train your body's own immune system to activate and kill cancer cells. And in fact, in 2022, we had an FDA approval of a combination immunotherapy regimen with Imfinzi and Imjudo, which was based on a phase 3 trial called the Himalaya trial. And this was a large global trial that found that with this combination of immunotherapy, we reduced the risk of death from liver cancer by 22% in patients. And in September of this year, we actually got longer-term follow-up from this study. And it was incredible to see that 20% of patients were alive at 5 years with this combination, compared to 9% in people who got the standard treatments. And impressively, yes, medications and treatments can have risks and side effects and potential toxicities. And so if you develop symptoms while you're on these regimens, it's important to talk to your doctor. But in general, this was a really well-tolerated treatment option for patients.
Are there any trials for people with this disease that are going on? That's a question I always get, so I'm starting to ask that.
Yeah, well, I as a person who is an active clinical trialist, I always tell my patients that if there is a clinical trial option, that is something to consider, because that's how we get these new treatments. That's how we move the needle. So there are a lot of ongoing trials. And, the immunotherapy combination I just talked about came from patients who were willing to volunteer to enroll in the Himalaya trial and to ask the important question of, does this immunotherapy treatment work better than the standard treatments? And so absolutely, thankfully, we have a lot of smart people designing clinical trials to try to improve outcomes for liver cancer.
Doctor, what advice would you give to patients that may be listening to this? Because my audience is made up of people born between 1946 and 1964, and you know them as baby boomers, and they seem to have some are healthy, but they seem to have a matrix of conditions.
Yeah, I think the most important thing is to recognize anything new out of the ordinary in terms of symptoms and to talk with your doctor and to seek medical attention when you're worried or something seems unusual. And, specific to liver cancer, there are a lot of online resources available like imfinzi.com, IMFINZI.com, which has a wealth of resources to help people learn about liver cancer, learn about how to diagnose it, learn about the treatment options and the side effect management. And so I would advise them to seek out those resources.
Dr. Shroff, this has been so eye-opening. I want my audience to know that Dr. Shroff is an Associate Director of Clinical Investigations and the co-leader of Gastrointestinal, excuse me for not saying that correctly, clinical research. You seem like you have a great job. Before I let you go, what's the best thing about your job, Doctor?
The best thing about my job is to be able to bring new treatment options and give hope to patients with diagnoses that historically have been thought of as devastating. So to be able to hold their hand through that journey and see that progress.
The best thing about my job, I get to talk to smart, intelligent, wonderful people like you who make a difference in the world. Thanks for being my guest on the Valder Beebe Show.
Thank you so much for having me.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.